Welcome, welcome. All right, we're going to dive right into it. So, I want to talk about Korean skin care line. I'm seeing that everywhere, TikTok, Instagram. Tell me about it. Why is everyone running to the Korean skincare?
I think Korea in general is just big on beauty, big on cosmetics. So they do a lot of facial plastic surgery,
Okay.
they just really are big on appearance. And, everyone watches Korean movies, sees their beautiful skin, flawless skin. So it's been the rage. For me, I think less is more. I don't think
Mhm.
you need a 10 or 12 step regimen every day to get ready. So really think it depends on your skin type. They are known for having very gentle products. So some
Okay.
face washes are excellent. Some of the sunscreens are excellent as well. But it's just really important to know your own skin type so you know what products will work well for you. But I don't
Okay.
do 10 or 12 step regimen.
So I think that makes okay. So with their skincare, do they do more? I know nothing about skincare, by the way, because I don't even think I should say what my skincare is because you probably book an appointment for me right away. Um,
Well, your skin looks
is it,
girl.
thank you. Is it more like cleanser? Is it two step, three step, or
Yeah.
like you said, is it just not the 10 step
Yeah.
process?
A lot, you mean the Korean regimens?
Yes.
A lot of their regimens include like double cleansing. So doing
Okay.
oil cleanser and doing a regular gentle foaming facial cleanser. And then after that, you may do some snail mucin or some moisturizer, um, sunscreen, of course. But generally, it involves several steps before the final step of adding sunscreen.
Okay. So what is the whole purpose of it, right? So I get it. We all want to look younger. I
Yes.
get it, right? But why are we even doing skincare? Our parents back in the day were using soap and water. There wasn't all these products. And now we have this, we have those little eye patches. We have when patients come to see you, and what are they coming to see you for? Is it for
Yeah.
aging? What are their biggest things?
I think everyone is just trying to look their best, right? Everyone wants their skin to glow and they want to eliminate hyperpigmentation, fine lines, just want to age better. And there are a lot of different things that can help with that. The most important thing by far is going to be aggressive sun protection. So whenever
Mm,
someone asks me what is the most important product, sunscreen. For anti-aging,
really?
for anti-aging, for hyperpigmentation, for skin cancer prevention, sunscreen by far is the most important thing. So a lot of the regimens, they have specialty things like vitamin C, which is an antioxidant that can just help improve your overall complexion. So that's great for patients with hyperpigmentation or patients just trying to improve their overall complexion. Retinoids, that's a big one. My patients
Okay.
right now come in and ask me about tretinoin. Where can I get tretinoin? That's
What
great.
does that do?
Yes, so that's great for wrinkle repair. It helps to improve
Okay.
collagen remodeling. It helps with hyperpigmentation. It helps with
Mm,
acne. It helps with texture. It helps with oil glands. So retinoids are excellent. Tretinoin is
okay.
for anti-aging, just for skin rejuvenation overall.
Okay, because I see the commercials, right? I see the L'Oreal. I can't say this word, the hyaluronic acid. I see all of that.
Yeah, yeah. So hyaluronic acid, it's great. It helps to draw moisture to the skin. So it's great for
Mm,
that is a big one now. So everyone is using hyaluronic acid and you're using a moisturizer. Neutrogena has a great product called Hydro Boost. The whole line is based on hyaluronic acid. So I
oh.
actually have a sample here. I brought some things to show you guys. This is a great sunscreen by Neutrogena. It's called Hydro Boost.
Okay, Hydro Boost.
Yes,
Okay, I'm gonna find it. I'm gonna tag it. I'm gonna post it. So
yes.
Hydro Boost. So that's a good sunscreen.
That is a good one. It's a moisturizer that
Oh.
has hyaluronic acid in it, but it also has sunscreen in it. So they make the
Okay.
AM with sunscreen, and then they have a PM one that comes in a jar. That's hyaluronic acid. So it's one that I hand out, a sample I hand out to a lot of my patients, especially patients
Mm.
on acne regimens that need to put some moisture in their skin to help minimize drying from retinoids. So that's a big risk of tretinoin. As much good as it does, it can cause some dryness, some irritation,
Okay.
peeling. So there's some things you can do to help minimize that risk, and adding a moisturizer to it can be very helpful. Hyaluronic acid is a really nice moisturizer. It's going to bring some hydration into the skin, but it's not going to make you too oily. So I really like
Okay. So we have a lot of questions, and I already knew this was going to be a hot
it.
topic. So we're going to be diving in. We're going to kind of be talking about it because I do want it to be a conversation with you all. I want to go back first. How do you? Is there a difference between if you have oily skin and dry skin? Does that determine what kind of products you use?
For sure, for sure. So patients with oily skin, when they come in to see me, I may recommend products that have more of a gel finish to it. Um,
Okay.
y'all have probably heard of La Roche-Posay. They,
Yes.
yes, they have this excellent moisturizer that's called like mattifying matte moisturizer. So that's patients for patients with oily skin. It makes your skin look more matte. So it helps decrease that oiliness. And then for patients with dry skin, I prefer to do more of a cream to add more moisture.
Moisture.
So
Oh.
products you use really is dependent on what type of skin you have. So
Okay.
sometimes I'll have patients come in and they're doing 12 steps, have really oily skin. It's only making their skin more oily, or it's clogging your pores, it's causing,
Mm.
versus trying to do less and maybe do some things that could be more drying to their skin.
Okay. Oh, wow. Thank you so much for that. I think I feel, and I don't know if this is possible. I feel like I used to have oily skin. And then as I'm maturing, let's say that word, right? Because God forbid we get older. As I'm maturing, I feel like my skin is getting a little dry. So I'm more mindful of what the texture feels like when I put on lotion or face or anything that I use.
Absolutely, that's very common. Most people actually generally have a combination where they're oily in some
Okay.
areas and you're dry in some areas. And so just finding products that work for your skin is important. And I think this is where it's great to go seek out a board certified dermatologist. I mean, generally, we can walk into the room and see certain features on your skin and kind of say, well, this patient has sensitive skin. This is the approach.
Mm.
There's small little signs we can see, even if it's light spots on the face that, or a little bit of flushing on the skin, that can kind of determine the regimen we choose for that patient.
Okay. Okay. So we're going to come to these questions. Please keep putting them in the comments. We're going to touch these. I want to talk about women, men and women, right? Because men I see now are doing skincare. I
Yeah,
see some men. Can men use the same products as women? Sometimes I put it on my husband. I'm like, try this. Is
yeah,
that safe?
absolutely. It just depends on your skin type, but absolutely, all of these products are like unisex. So men can use the exact same things. Men with dry skin can use similar products as women with dry skin.
Mm.
So retinoids, that's a big one. I'm having a lot of men coming in now to see me in clinic that are being more conscious of their appearance and trying to, just trying to gain more even complexion or smoother.
Nice. Nice. Okay. We touched a little bit about sunscreen, about how sunscreen is super important. And I think you shared one of the products that you love. What about for children? Should we put sunscreen on our kiddos? What
Yeah.
kind of sunscreen would you recommend?
Yes, sunscreen's very important from a young age. So for babies, generally I prefer more mineral sunscreen. So your
Okay.
mineral sunscreens are going to be like zinc oxide or titanium dioxide. So they don't have any chemicals in them. So as you can imagine, it's going to cause more of like less of an allergic reaction. It's going to be more tolerable. Now, the only difficult thing with mineral sunscreens is that they don't blend in very well. They kind of leave that little ashy or white cast
The
appearance.
white cast. Oh, okay. I mean, I'm like, they're kids. As long as you're safe, I can keep the white cast on you.
But you'll
You'll
see
be
most
fine.
things that are more cosmetically elegant on skin of color, it's going to be a blend. It's going to have some minerals and some chemicals in there just to make it blend in better.
Okay. Good point. Good point. So let me ask you this because I genuinely, seriously don't know this. And I
Okay.
hear hyperpigmentation a lot. What
Yes.
is that? If you were to just explain, give a general to us layman people, What does it mean when people say, oh, hyperpigmentation, or when patients come to you?
Yeah. So as you can imagine, pigment is just like color, right?
Mm-hmm.
Hyperpigmentation is going to be a lot of pigment. So these are going to be dark spots that you see on the.
Okay.
And hyperpigmentation can arise or come about from many different things. Like you have a little acne spot, it leaves a little brown spot behind. That's a hyperpigmentation. You may have patients who come in with a big mask of brown discoloration on your face. That's under the umbrella of hyperpigmentation as well. So hyperpigmentation is just a very vague term, and within that hyperpigmentation, we have many other things that can cause it. Is it post-inflammatory hyperpigmentation? That's going to
Mm.
acne? Is it a condition like melasma? That's going to be hyperpigmentation as well. So it's just increased pigment in the skin. So just dark patches.
Okay. Awesome. So let's take a little pause here. Whew. These comments are commenting today. Oh, Dr. O, are you ready?
I'm
I'm
ready.
gonna scroll all the way up, you all. I'm gonna try to get all the way from the beginning on what people are asking and just kind of have this be a conversation. Keep dropping the questions, comments in the chat. Okay, so someone talked about yes, please, the amazing Dr. O. That's my dog. Okay.
Oh,
Um, we have someone talking about yes. Let's talk about K. We talked about the K Korean beauty. Is Vaseline safe to use on skin? I keep hearing otherwise.
I love petrolatum. So Vaseline petroleum jelly, I love it. It's one of those things that serves as a good barrier, can be
Okay.
clean, and like nobody is allergic to petrolatum. So it's a great product for babies as well when you're trying to hydrate their skin. So yes, it's safe for the skin. Now, I wouldn't put it on the face a lot because it can be very occlusive and so can clog up your pores, clog your oil glands, cause acne. Some patients, I recommend they put it on your face if they're on Accutane or something like that, where their skin is very dry. But otherwise, Vaseline's great overall. I just wouldn't moisturize my face with it.
So I was gonna say that I was like, if it's safe for babies, it should be safe. So I did. I used it a lot for my daughter. I use it
Right.
as a berry if I were to put like a cortisone cream or something to just kind of mix it. I think you even gave me that idea. Like, don't put it directly on her skin. Just kind of mix it in, level it. Awesome. Someone said, why is hyperpigmentation such a big issue with women of color? Ooh.
Yes, very good question. So, and it's very easy to understand. So, the sun activates melanin production, right? Black patients in general, we have more melanin in our.
Mhm.
So, and we generally don't really wear a lot of sunscreen. So just from being out in the sun, you're going to have more melanin being produced. And that's generally why most people come in there like, my face is one color, my chest is one
Yeah.
color, this is one color, and it's based on the amount of sun exposure you're getting. So sun protection by far is the most important thing for getting even skin tone. And a lot of patients don't know sunscreen only lasts for 2 hours. So
Oh,
with your
wow.
screen, you put on your makeup, you leave your house, 2 hours later, you have nothing on. And I also get a lot of, oh, well, I work indoors. I'm never out in the sun. Well, when you're driving in your car, that sun coming in through the window, that's going to cause hyperpigmentation. Sun coming in through your windshield, that's going to cause hyperpigmentation. Walking to the grocery store, walking around the neighborhood. So that is the reason why we have a lot of pigmentary disorders, because we have a lot of melanin in our skin and it's
Mm.
being activated. If it's from sun exposure or if it's from any kind of trauma, and trauma could even be, well, acne bump, right? Acne
Right.
inflammatory condition. That inflammation will cause some melanin to be left behind.
Oh wow, that's a lot. I didn't even think about it. You're right, because even driving in today, I had to put my visor down, and I'm thinking now, like, oh my gosh, how much sun was in my face? Because I'm always ducking.
Right, right. So we get a lot of sun. We get a lot of sun.
And I guess that's why women of color, that's why we don't understand that our face, our neck looks different. So, when I sit at someone's doing my makeup, I'm like, please get my neck so that it matches because most of that sun is hitting my face, but
Yep.
not really everywhere else.
So
Wow.
that's the big one. The chest is real light and
Yes.
it's darker, and it's all
Yes.
chronic sun exposure.
Yes. Oh my gosh. Thank you so much for that. I think you covered this, but maybe you can touch a little bit more on products. So I want to ask about what about for kids? So I'm thinking they're talking about sunscreen. What type of sunscreen? And we talked about the ones where it's, safe for the kids,
Yeah.
less chemicals and things like that. Do you have any brand names that you recommend? Again, these are all general recommendations. I always urge everyone to go and reach out to their dermatologist for specific things. So don't go around and say, Dr. O said this the only thing. She doesn't know your history. She doesn't know the details of what you're going through. She's just going based on what she recommends for her patients. But please do reach out to your dermatologist for specifics. So recommendations that you give out for your kids.
Yes. So Neutrogena baby sunscreen,
Okay.
that's pure zinc. Neutrogena has one called Share Zinc, that's pure zinc. I'm not gonna lie, I use a mix of chemical and mineral on my kids because I don't want them ashy. This is a good one by La Roche Posay, and this is a sport one as well.
Oh,
So
so they
this
can get in the water.
Yes. And so this is one you can get in the water with, and it's not going to run all in your eyes. Like if you go swimming, if you're running, if you're active, and this blends in beautifully on black skin. So
Perfect.
I love the La Roche ones. I use Hydro Boost on my kids as well. And this is using a thick amount of it, if you can see it here.
A little bit, yeah.
It rubs in really well.
Really good. Yeah.
Really.
Awesome.
That's a,
Thank you.
of course.
So let's go to the next one. It says, okay, technically, don't you need to reapply the Hydro Boost every hour for the sunscreen to work? Ooh.
The Neutrogena Hydro Boost with sunscreen every 2 hours. Yes, you would reapply that. But you don't necessarily have to reapply this. There is a company called Color Science, and they make a product called Sun Forgettable. Now, this one is a great one for women because it is a powder sunscreen and it comes with a retractable brush. So if you have your makeup on, I know nobody's not about to put no lip on top there.
No.
You this sunscreen powder, pull out the brush.
Oh, on top of your makeup?
You can do it on top of your makeup. They even have
Oh.
lucent. I haven't tried that. I've tried the one that's been color matched to my skin tone, and it worked great.
Oh, wow. Okay. I like that. I think that I'm more drawn to something that I'm out and about. I can just pick it up, put it on top of my makeup, and keep moving. Because if I have to take off my makeup, put on sunscreen, nobody got time for that. But
I
if it's something that can blend in, absolutely.
And Neutrogena actually has a nice, I forget what it's called. I think it's like a mineral, I don't know, it's a mineral like color match sunscreen. But they have this sunscreen in different skin tones and that are nice and match with black skin as well. And you can actually apply that sunscreen and it's tinted. So it matches to your skin tone. You don't necessarily even have to put makeup on. You can just
Oh.
Elta MD UV Clear, that's a great sunscreen as well. The tinted one, you can put that on nicely and it blends in pretty well on black skin.
And I think we're moving more towards natural looks, right?
Yeah.
And not necessarily looking made up. So if I can look natural, but still kind of covered throughout my day, I think that would be really good.
Mhm.
Please share your best products for oily skin.
Yes. Okay. So, like I mentioned, La Roche, their mattifying matte. That's awesome. Over the counter, actually, y'all probably know Differin,
That's
Adapalene
fine.
0.1%. That's the generic name. That's a retinoid that's over the counter. It used to be a prescription strength retinoid. It's now over the counter. That's a great product for oily skin. You just use it at bedtime and it can work great for just improving your overall texture, shrinking oil glands, so helps decrease that oiliness. I really like that.
Okay. So let's say I'm at the store
Mhm.
and I'm like, oh, I've watched the Health Hub with Dr. T and I'm here, da, 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 and I pick up a product and I have oily skin. What should I see on the back of that product for me to say, yes, this is the one for me? What product, what name or what thing should I
What?
be looking for?
Okay. Also, if you have oily skin, most of them will say like oil control. Like CeraVe has a nice oil control gel moisturizer. I really like that. Product with salicylic acid are great for oily skin. I would stay away from thick moisturizers, like thick
Okay.
Kiehl's. They make these thick moisturizers. A lot of my patients use them and they have oily skin. Stick to something light, and gels can be very good. So Neutrogena Hydro Boost, they now have like a water cream and a water gel. If you have oily skin, do more of the water gel as your moist.
Okay.
If you have
All
more
right.
skin, do more of the water cream moisturizer.
Wow. I didn't, y'all, if I tell you my skin, now I'm about to be all in the store. I'm going to be at CVS, reading everything at CVS. Okay, I'm going to say this wrong. So, Dr. O, help me out. It's azelaic, azelaic acid versus tretinoin, tretinoin. So, someone was saying one versus the other. What can you tell us?
No verses, you do both. You do both. I love it. So azelaic acid, that's one of my favorite products for a couple reasons. Helps with acne, helps with hyperpigmentation, and it's also safe during pregnancy. So pregnant women who have acne, hyperpigmentation, this is a great product for you. Okay. Tretinoin and azelaic acid are a bit different, but they work well together. So I like, for my patients with hyperpigmentation, I like azelaic acid in the mornings, tretinoin in the evening time. Sometimes I'll even throw in a little bit more. Looks like y'all know a lot about your ingredients. So
Okay.
throw in some kojic acid, throw in some tranexamic acid, and compound all of those things, because we can find a synergistic effect when we use these different things with different mechanisms of action. It can really build up and get you better results.
Wow. Yeah, you guys really do know your stuff. Y'all be Googling and TikToking. Okay. What is the best mineral sunscreen for persons of color?
Oof. I would be lying if I told you I use mineral sunscreen. I don't.
Why don't you?
Because I don't like to look ashy. I like to blend in nicely. So let me see. Like I mentioned, the new Neutrogena ones are really well, really good. I think it's called like Neutrogena tinted. I'm sorry, I can't remember what it is.
Okay.
Comes in different shades. That's a good mineral one. But mineral sunscreen, black skin, it's not the most cosmetically elegant. So
Okay.
I
Because,
use.
we want to look good. If we're doing this, we want to look good. Is double cleansing necessary?
I don't like double cleansing.
Why not?
I don't really
So,
like.
what is double cleansing? Am I just washing my face twice?
Basically, once with
Okay.
the cleanser and then with the foaming one. It's a big thing with all these Korean products. So I guess the idea is, oil cleansers are good for removing like makeup, like oily stuff on the face, which is fine. But I have people double cleanse in the mornings, double cleanse at nighttime. I just don't really understand the point of it. I'll show you some cleansers that I like personally.
Okay.
This is a good one. By
Oh, oh, you like this La Roche people.
Let me tell you, I have different people here. I'll show you all my different.
Okay.
But yes, La Roche, they make some great products. So their gentle foaming moisturizing wash. This is a good
Mm,
one. They have a purifying cleanser. That's a good one with patients with oily skin. They have this one, which is a medicated gel cleanser. This is good for oily skin too. It has salicylic acid, which is great. Um, More La Roche. They have hydrating gentle cleanser. I really love gentle cleansers because they really don't overstrip your face, because you do
mm,
that moisture, right? Especially if you're going to be using a product like tretinoin, which can be really drying, or you're going to be doing, azelaic acid. Azelaic acid is generally gentle, but it can cause some irritation on the skin. So I don't really like to really strip the skin off of all its moisture. Now, yeah, if you have makeup on your face, CeraVe, they make a really nice, like, plant-based makeup removing wipe that's really gentle and works very elegantly. So I like that, and then following with one of those foaming facial cleansers. But if you double cleanse and that's your thing, fine if you want to do that with makeup on. I just guess I don't really see the point of double cleansing in the morning.
Mm, makes
So
sense.
I don't recommend it. That's
You
never,
don't recommend it.
that's not
You're
a,
like, nah, not needed.
but if you're doing it
And it
and
works.
I don't mess with it.
All right. Skincare routine. Okay. Dr. Cherry's 508 says skincare routine for hormonal acne and how can a derm help? Yes.
Yes, we can help a lot. Hormonal acne is difficult to treat. So if you think about it, hormonal acne occurs because certain hormones called androgens bind to these receptors in your body. It increases oil production, which is broken down by bacteria, which causes these cystic lesions, right? So if the hormones are the problem, you'll see topicals, your tretinoin, your clindamycin, they're not really going to do a good job. So their
Mm,
things will either birth control, which some dermatologists prescribe. I don't prescribe birth control, but that's an option for hormonal
okay.
acne. A big one you're going to see is spironolactone. We love spironolactone. It really gets the job done. Like it will decrease oil production. So it's going to improve the overall appearance of your skin. It's going to really help with those, those kind of flares that you have when you're ovulating, right before you're ovulating. Spironolactone
Right.
is an amazing medication. So that's usually our approach is usually
Okay.
spironolactone, birth control, or if it's really uncontrollable, we'll throw in some Accutane.
Wow. So you got to hit it with the big stuff. Some over the counter things aren't really going to cover that because, like
Yeah,
you said, it's the hormones. You
yeah.
can only control that for so long. And with such
But I
different kind
do,
of products.
yes, I do have some patients who are like, I don't want to do oral medication. I'm not going to do it. What else can we do? And I have had spironolactone compounded to a topical form, and it has worked amazing for some.
Oh.
Not all patients, but some patients do really well with it. So that's an option as well. There's a product that's actually FDA approved for hormonal acne called Winlevi. That's a topical medicine. That one
Mm.
is hit or miss. I've prescribed it so many times when it first came out, it didn't really work for anyone. But I have a couple patients here and there that I'll prescribe that for. But if you have hormonal acne, see a dermatologist. We
Yeah.
need something oral to get it under control.
I was like, that one is deeper than just cleansing, and that's really having somebody understand your skin, hormones, and so forth. All
Absolutely.
right. How often should we exfoliate our skin?
I like tretinoin. It's an exfoliator. So I
But
don't,
how often? Once a week?
I
Once
mean,
a month? Every
with,
day?
with tretinoin, I mean, you put it on every night. So I
Oh,
don't think you necessarily need to do a, glycolic acid exfoliation. I mean, you could do that once a week. I don't exfoliate at all. But I have my retinoids that do my exfoliation for me. So I don't feel like I need to do that. My regimen is real simple. I think if you keep your regimen simple, you can be successful and it will work well. Generally, I see I'm using this toner, I'm using this exfoliator, I'm using this and using, and I can't even keep up with it.
right.
And generally, what happens? Irritation. You got to be careful with
Mm,
black skin. Like our skin is sensitive. If you mess around with those melanocytes, they're either going to throw down pigment or they'll get stunned and you get light patches or you get dark patches. So
mm,
you want to be more conservative. Like less is better. The less you do to your skin,
and more.
lower the risk of getting irritation and hyperpigmentation or hypopigmentation. That just means lighter spots.
Lighter. Okay.
So how often should you exfoliate? It depends. If you have a retinoid, you don't really need to do any additional exfoliation.
Wow. I think one of the soaps I get, I think I exfoliate every day. I don't know. I'm gonna have to go
What's
read.
the
I'm gonna throw everything out and start over today.
why? Like as long as you're not doing like a scrub and glycolic acid scrub and you're doing that, I think that would be a lot.
All right. Someone said, let's talk about over the counter peels as well. So some peels that we have over the counter.
Peels, like
Yes.
PILS.
Yes. Peels. Yeah.
Oh, I don't recommend anybody do a peel on themselves. I think you need to go into clinic and have it done. If it be like an esthetician that does it or your dermatologist that does it. We see a lot of the stuff gone wrong. And you
And then
really
we come to y'all to fix it.
correct. I'm like, How did you even get that? The depth of the peel really matters. Like
Mm,
with black skin, you have to stay superficial. You have to stay superficial. You don't go in deeper because when you go in deeper, that's when you trouble those melanocytes and cause
mm,
irritation. So, chemical peels, there's an art to it. That's not
right.
something anybody does at home.
So I can't just buy one over the counter and put it on my husband and say we doing skincare today.
Hey,
No,
do it on his back and see how it comes.
not on this face.
Don't mess
Good one. Good one.
that
Do
where his.
you have a favorite vitamin C serum or do you recommend it?
I love vitamin C. I have several favorite. All medical grade. So there are like 1,000 vitamin C's out there. I don't know if they work.
Mm.
Oh, some don't work. Some do work very well. So I always recommend, usually if I'm recommending a product to a patient, I've tried it and I know it works. Everything I recommend, I have tried. I pretty much try everything that comes out. Um,
That's
yeah, so Revision, they have a vitamin C lotion. That's amazing. Revision vitamin C 30% lotion is really good. Everybody knows SkinCeuticals, CE Ferulic. That I think is probably the number one vitamin C in the market. That's a great product. Um, Skin Medica, they have like a vitamin C and E lotion. That's amazing. Now, all of these are dollar sign,
I was gonna say.
but they work and they work well.
And I feel like if something works, we'll invest. People are investing now in their health. They're investing in their skincare. We're living longer. We want to live longer. So we want to look like we're not living as long. So I think if it works, like I wouldn't mind purchasing something if I know it works. And I think you made a good point about something that I haven't heard is that you try a lot of those products.
Mhm.
Sometimes, and your skin is different, right? Your skin may be different than mine, but the fact that you're even willing to be a test subject, can I say that? And
Mhm.
actually tell patients like, oh, this is going to make you feel tingly. This is going to make, whatever the case may be, makes me want to trust my dermatologist more because you know what you're telling me based on first experience, what I should expect. I think that's a big deal.
And I try it for 12 weeks. You got to give most things 12 weeks to see
Oh,
how.
that's a good one.
So I try it all.
Because people try something today and then tomorrow they're like, nope, don't want it. And
Mhm.
they move on to something. Then we have a whole line of products in our on our sink.
Mhm. I have patients come. I tried azelaic acid, it didn't work. I tried kojic acid, it didn't work. I tried tretinoin, it didn't work. How long did you use this? 1 week, 2 weeks. You have to give it.
Oh,
Takes at least 12 weeks to see an improvement on any skin regimen. Even when we're treating acne with medications like Accutane, and that's our big gun for acne, we give it 12 weeks.
oh wow. Oh wow. That's good.
Yeah.
What's the least invasive but also effective way to remove hyperpigmentation spots on your face?
Like over the counter?
Yeah, like
Yeah.
what's the least invasive but effective way? Yeah, I guess over the counter could
So
be good.
topicals, y'all have probably heard of Faded by like Topicals. It's in a pink bottle that has, if I believe, kojic acid, azelaic acid, maybe tranexamic acid. That's a good over-the-counter product to use that works well for hyperpigmentation. Prescription medications, obviously, like we already mentioned, are azelaic acids, are tretinoin. Depending on what type of hyperpigmentation it is, we'll do some hydroquinone
Oh
and
wow.
compound that as well, depending on what we're treating. So topicals can work very well. Chemical peels can work well. Microneedling, it also depends on the depth of the pigment. If it's something like like an acne spot, that's easy to treat. That's going to fade off with time, even if you do nothing. If you wear sunscreen, your acne,
Mm,
it will fade off on its own overnight.
wow.
You do.
Thank you.
Mhm.
What's your favorite recommendations for chafing during the summer while working out and running, etc.? That's a good one.
Yeah, there's actually like a line, y'all have probably heard of it called Lume. I think it's like a line that's created by like an OB-GYN. They make like body deodorants. They have really good products. So that line is good for chafing.
Wow. Very good. I'm gonna check that out. Maybe I should
L
get back
L.
to running.
That's how you would spell that.
Sorry, go ahead, say that again.
Lume.
Lume.
That's how you would spell that product. Yep.
Okay. Dr. O is, oh my gosh, these words, y'all, is niacinamide,
Yeah.
NIAC. Okay, I spelled it right. Good for oily skin. If so, should it be applied before or after vitamin C serums?
Yeah. You can do it before. Vitamin C, I always like to touch the skin first. Um, so this is one thing I want people to spend less money on. Like spend less money on your moisturizers, spend more less money on your sunscreens, spend less money on your cleansers. Do something cheap like CeraVe, Cetaphil,
Mm.
Neutrogena, then save the big bucks for your products like your vitamin C's or your retinols, your medical grade stuff. That's one thing that trips me out. People will spend $40 on a facial cleanser. And I'm like, you could just use CeraVe or La Roche or, Neutrogena,
Right.
and then actually save your money to buy the expensive stuff like SkinCeuticals, vitamin C, E ferulic. So save your money for your antioxidants or for your retinoids or for growth factors. Skin Medica makes
Mm.
great growth factors. Generally, you really don't need to be doing growth factors until you're a little bit more mature. You
So we're not saying that O word.
Yeah, it's growth factors work well, but they're very expensive. Probably about $400 or so for those products, but they work well.
Nice. Someone said, do you recommend Black Girl sunscreen? So somebody else said, yeah, a lot of people recommend Black Girl sunscreen. I feel because of the name.
Let me tell you, I used to recommend them just because I wanted to promote like Black Girl sunscreen, but I don't know that it works very well.
Ooh.
Yeah, I think it doesn't work the best for sun protection.
Okay. I've investigated a lot of mineral sunscreens so far. Tatcha, Tatcha, mineral silk sunscreen blends the best for me.
Okay, how much are you spending on that?
Oh, drop that in the chat. Okay,
Yeah.
I want to transition a little bit because we can talk about skin forever. Oh my gosh, you guys, this is so good. We're gonna have to do like part two, three, four skin because we haven't even touched it, right? I want to transition a little bit to another part of your specialty, hair loss, dandruff. I know that's a whole nother live. I know.
Hair loss is a lot.
Talk to me.
Hair loss needs its own episode, okay? It is our biggest, this is the real pandemic, okay? Is hair loss,
Wow.
I tell you. Especially in patients with skin of color, especially in Black women, like
Mm.
so many things that have been taught to us as being protective hairstyles can cause a lot of just chronic terminal end stage hair loss and scarring. Like, we can talk about dandruff. I'll touch a little on hair loss, but I really want a lot on hair loss because
Okay.
it's such a big thing, from postpartum hair loss to traction alopecia to scarring alopecia to female pattern hair loss, male pattern. There's just so much we can talk about. And I think our time is going to run up
We're
before
good. Yeah.
I. So let's talk about dandruff.
Yes, let's
So,
talk about dandruff because a lot of women of color and none also have dandruff. I used to think, cliche, I used to think, oh, it was only women of color with dandruff.
mhm.
False. So let's talk dandruff.
Everyone gets dandruff. So, seborrheic dermatitis. A lot of y'all may be familiar with that because I think there are a lot of people here who know a lot about dermatology. And so, what seborrheic dermatitis is, it's a condition that's caused by a yeast called Malassezia furfur. Okay.
Mm.
This is normal flora on everybody's skin. It's on our face, it's on our scalp, our chest, our back. This is what causes dandruff. So it's this yeast that's on our scalp. And some ways to decrease this yeast is by washing the hair. So everyone will have dandruff if you don't wash your hair frequent enough,
Mm.
not increasing the yeast flora on the scalp. But basically, when we're treating seborrheic dermatitis, we're doing a couple things. One, we're trying to kill that yeast and decrease that yeast content on the scalp. And so, a common product we'll use ketoconazole. Over the counter, there's a Nizoral, which is an over the counter version of ketoconazole. Y'all have heard of Salsin Blue, um, Head and Shoulders, those primarily use zinc to kill the Malassezia furfur. We'll also do topical steroids as well because your body, there's an inflammatory reaction to that yeast on your scalp that causes all that flaking. So we do things to help decrease that inflammation. So even over the counter, like hydrocortisone ointment, that's
Mm-hmm.
a good way to treat dandruff. So if you need to do something at home, get Nizoral shampoo over the counter, get Selsun Blue over the counter. Now, some tricks is that these shampoos can be very drying on black hair. So I say, think of it as a scalp medicine, not a hair shampoo. Use it to wash your scalp. Let it sit in there for about 10 minutes, then rinse it off, okay? Some things you can do to protect your hair. You can put some coconut oil in your hair while you use it on your scalp. Then after you rinse it off, follow with your hydrating shampoo for your hair. Follow it with your deep conditioner for your hair. But even doing that over the counter can make a big difference.
Oh wow. I do want to say I used to have really bad dandruff
Mhm,
and can't tell my husband, I'm pretty sure he's on the live. So I use his Head and Shoulders.
mhm.
And you're right. Like I felt like it dries out my scalp, but I've seen a difference.
Yeah.
So I may use all my conditioners and everything, but I always start with his Head and Shoulders, and
Yes.
I feel like I've seen a difference.
Absolutely. Now, if you don't wash your hair for 2 months, don't be confused about why you have, you know, you have to wash your hair more frequently. Even Black patients, I recommend washing your scalp every week. If
Mm.
you're away with washing it every 2 weeks, that's fine. But if you're having dandruff and you're washing your hair every 2 weeks and it's not getting better, increase the frequency of your washes. Okay. Now, dandruff or seborrheic dermatitis and psoriasis can look very similar, sometimes so similar that we even may think psoriasis is seborrheic dermatitis. Sometimes psoriasis presents and is very fine. And that's an important thing about coming to us, right? Usually if it looks like seborrheic dermatitis, I'll treat you for seborrheic dermatitis. We even sometimes do oral medications, like oral antifungal medicines. But if
Mm.
you come back to me and you're like, it's not really getting better, then I think, oh, is this psoriasis? And some
Okay.
biopsy, because clinically it may look like seborrheic dermatitis to 10 out of 10 dermatologists, but a biopsy may show a different diagnosis. And so with scalp psoriasis, we treat a little bit differently. We treat with very
Wow.
similar with the same things, but we have other options for that.
Yo, the hair is gonna be a lot. So I
Dear
have one.
God, dear
I know we're gonna do a live on just hair.
God.
Scalp care. Cause you touched on scalp, right?
Uh-huh.
Scalp care. Someone said itchy scalp even when washed and no dandruff.
Hmm. It could still be seborrheic dermatitis. You may still have some inflammation there. And even ketoconazole shampoo or Nizoral is an anti-inflammatory. So signs of inflammation, itching, scaling, redness. So that itching is also a sign, could be a sign of inflammation.
Wow. Yo, this is a lot. This is a lot. Okay, hormonal hair loss. So someone talked a little bit about crowning solutions for hormonal hair loss slash thinning in the crown area.
Okay, so thinning in the crown, this is why I said hair loss is its own thing. Thinning in the crown is probably not hormonal.
Ooh.
The crown is probably CCCA.
Somebody posted that in the comments. I just saw
CCA.
that.
Oh, CCCA. So, oh my God, we have to do a whole, because our edges are struggling. People
Girl.
crown is struggling. We have to do a whole one. But most common causes of hair loss in Black women, traction alopecia, that's thinning of your edges. And then CCCA, that stands for central, that's where it starts, your crown. The other C is centrifugal. That's how it spreads. Starts like this and spreads out like a centrifuge. Cicatricial is a fancy word for scarring. So it's a
Mhm.
type of hair loss. And then alopecia just means hair loss. So if you're having usually may start as tenderness on your crown, breakage on your crown, thinning on your crown. Let me tell you, run, see a dermatologist, whoop, see a Black.
Ooh.
Okay. Because we are generally interested in hair loss because it's something that plagues a lot of Black patients. So you'll see a lot of Black dermatologists have a special interest in hair loss and pigmentary diseases just because it's something that plagues the population. Hair loss is very hard to treat.
Wow.
It's very hard to treat. So sometimes if you see someone who really doesn't have an interest in hair loss, they may just be like, there's not much we can do. Because
Oh,
it's true. Before there wasn't a lot that we could do. We have a whole lot of options now.
okay.
So hair loss is its own
It's
big,
its own thing.
it's its
So
own when you come to your dermatologist. We want to spend that time and get a
with
solution.
hair loss.
Yeah.
So the CCCA, three C's, right? The
Yes.
CCCA, is that also for the men when the men are balding? Is that the exact same thing?
No, that's different.
Oh, so what about men?
That's male pattern hair loss. Men do have CCCA as well, but
Okay.
mainly when I've seen CCCA in men, it's been men who did like locks or dreads
Okay.
start getting that, that hair loss. So hormonal hair loss or female pattern hair loss is not a scarring type of hair loss. It's just things
Okay.
time. And generally with female pattern hair loss, how that presents, widening of the medial part, vertex hair, it can involve some of the crown, but usually this is where we see it, or some recession of your hairline where you feel like your hairline is receding. CCCA is very unique where it's like,
Okay. Wow. I'm too excited because I'm like, this, we're gonna do part two, three,
yes,
four. I'm gonna jump around and kind of see what some people are talking about in here. Oh, someone said, how about y'all in these words? Finasteride, Finasteride to treat hair loss.
yes, finasteride is great, especially for female pattern hair loss. CCCA, I prefer, you can do finasteride for that too, but I prefer oral minoxidil. That works great. And sometimes I'll even combine the two. But even better than finasteride for women is dutasteride. That works excellent. But we really have to select the patients very carefully for that because dutasteride and finasteride can cause significant birth defects. Dutasteride tends to stay in the body a lot longer than finasteride, so we generally will avoid that in patients with childbearing potential. So
Mm.
kind of depends on the individual patient. Everything is customized, but dutasteride, oral minoxidil, those are good medicines. I think oral minoxidil, I mean, that has really changed like the
Game
game
changer.
loss. Yeah.
Okay, I'm gonna go back to sunscreen.
Mhm.
Someone said, "What is this?" I meant to say, yeah. Some say SPF levels. What levels? Some are saying 100, some are saying 50, some are saying 35.
Yeah.
What are some good SPF levels for women of color
Yeah.
and not women of color?
So research has been done. It's shown that beyond SPF 50, there's really not much of an advantage. So if you're doing SPF 100, SPF 300, it's not going to give you much additional benefit. Just doing an SPF 50 is good. SPF 30 plus is
I've
what we,
seen 30. Yeah.
yeah, SPF 30 plus. Anything above a SPF 30 is good. Um, I usually do around like a 50 or so with the products that I use.
Okay. I know we had asked someone a price for something they used earlier, and they said $65. Oh,
Girl,
it better
no.
be.
For sunscreen, no.
Move, run away.
That's too expensive.
Okay. Last question because ooh, last question. Let me see. Somebody give me a good one. Let me see. Last question because I'm trying to touch every question in here. I love the interaction. Thank you so much. Someone said Dr. Kenny is so smart. Yes, she
Oh,
is. Oh, are you taking new patients, Dr. O?
I'm taking new patients, but please don't hate me because I'm booked out so far. I booked out like 3 months, but I'm always happy to see new patients.
Yes. Okay, this last question goes to underscore SEDDI. What if you have lupus? Scalp tends
Yeah.
to look scarred and hair thinning. How can we help with that?
Oh, I love to treat hair loss from lupus. So if you're wearing lupus, if you have lupus, you already know you need to be out of the sun. You need to be
Mm.
wearing sunscreen, wide brim hats whenever you leave your house, sunglasses. Unfortunately, most of your treatment is going to be done by us. We can do scalp injections, we can do hydroxychloroquine, we can do oral minoxidil. There's so much that we can do for scalp lupus. Come check us out. In
Very good.
my Instagram, my last post, which I think was Christmas time of 2024, I have a list of a lot of Black dermatologists in Houston. So
I
there,
was gonna ask for that.
I have so many. You need someone in Atascocita, Dr.
Ooh.
Tang Tang. You need someone in Humble, Dr. Igasi. Um, you need someone in Houston area, Dr. Simone Stalling, obviously me, Dr. Jacqueline Manasso, Dr. Isabella Jennings. These are all Black in Kelsey, we have like 7 Black dermatologists. Dr.
Wow.
Davis is in Katy. Oh my gosh, Dr. Maloney. I think she's in Houston.
We could go on. So you have a list.
I have a list. I
Good.
have some in my last post.
Okay.
Get together. Dr. Asampa, she's at Baylor. Oh my gosh, so
So
many.
we're gonna post that. I'm gonna take that
God,
off your page.
go
I'm
on.
gonna post it.
We're everywhere. There are at least 20 Black dermatologists in Houston.
Wow.
Maybe
So
20.
that's good.
Male and
That's
female. There are male Black
and
dermatologists.
female. Dallas area. We're gonna look for some in Dallas area too.
Dr. Danique Woolfolk. She, she's your go-to in Dallas. Dr. Danique Woolfolk. Blackburn Woolfolk Dermatology.
Wow, this is amazing. Thank you all so much. I think we actually had our highest number of viewers in this live. So this tells me that we're on the right path. So many people have been asking for part two. Someone said maybe a fall edition. Absolutely. I just want to thank you, Dr. O, for taking the time out to share your knowledge, to give your recommendations. Like I said, this is all just her recommendations. She doesn't know you personally. Go out and see your dermatologist. I'm going to post the links of the patients, I mean, sorry, of the providers so that you can reach out. But I just want to thank you, Dr. O. This was amazing. This
My,
was great. Thank you, everyone, for joining. Next week, we talk about nutrition. Nutrition is next week. So we're going to talk about what we're putting in our bodies. We're talking about our skin. We're talking about our food, all of that. But thank you, Dr. O. So many people in
my
here are like shouting you out.
Thank you for inviting me. This is amazing. I tune in every week to watch. So I'm going to be tuning in to learn more about nutrition and
Yes.
how I can get my BMI lower.
Oh, can't we? Don't we all need that? Thank you all so much. Thank you all. Have a blessed week. Have a great evening. I will see you all next Monday here at the Health Hub with Dr. T at 8:30 p.m. Central Time. We're talking nutrition and we'll go from there. Have a blessed one. Thank you all so much. Thank you, Dr. O. Thank you. Thank you. You're coming back, Dr. O. You're
Obviously,
coming back.
hair. That's my jam. We got to
Yes, we're coming back for hair. Bye, you guys. Thank you. Have a good one.
get
Thank you.